Welcome to a Wiser Retirement podcast. Before we get started with the episode, I want to tell you about a new ebook available on our website called Buyer Beware. Why do they keep trying to sell you that annuity? This ebook covers the various types of annuities, negatives to owning annuities, and better investment alternatives to annuities. To download this ebook, you can click the link in the episode notes or go to wiserinvestor.com and you'll find it at the bottom of the page. Now on to today's episode.
Welcome to a Wiser Retirement podcast, where we believe the best financial advice should always be conflict-free. I'm your host, Casey Smith. Today, I'm joined with Logan Steele from Steele Choice Insurance.
Yeah.
If I could spit that out real quick.
You got it. Thanks, Casey. Thanks for having me again.
This is visit number 2. I think our record might be 3 or 4 with Randy Hargett at our long-term care guy. But
we'll get there eventually.
Happy to have you back. And today, I wanted to talk about the state of healthcare and what's going on there. You helped us with our corporate renewals here recently, so I feel like I'm front and center on a lot of healthcare things going on right now, just because I was forced to be. But first, it's also that time of year when the leaves change colors, and we have to decide which Medicare plan we want to.
And you see all the Joe Namath commercials, and yes,
just in
the
time for football
nonstop
season.
phone calls of Medicare and everything else. Yeah. So marketing is really ramped up.
I mean, we have hundreds of listeners onto our podcast. I think some of these are Medicare eligible, but unfortunately, the ones that really need to hear this episode are probably in their 90s. And they're the ones every year at our firm that get that mailer that says you must change your Medicare to this, or you're going to lose it.
Right.
And it's like, it's a really slick advertisement, and they end up changing their policy.
Happens all the time. I have clients that it happens every single year. And I have people that call me and say, oh, I got this new card in the mail, and they just randomly got signed up.
Yeah.
Or a son or a daughter calls and says, oh, my mom's plan got changed somehow.
Yeah.
But they've gotten a lot slicker. I mean, it's, the calls are relentless.
Right.
A lot of people are calling in to these, TV commercials that they see because they see, oh, you can get everything. You can get your groceries paid for. You can get your rent paid for. You can get free dental. You can get free vision. And, some of those plans include that. But, there's trade-offs there that, usually that's not being communicated as clearly as it should be when they're speaking with that individual. So
if you have elderly parents, this is the time of the year to tell them not to change anything unless they need to. We'll talk about that,
unless they need to. But we've had a lot of changes in Medicare, and it's important, especially for the sons and daughters out there that are helping their parents with Medicare. Communicate that a lot of the information that they're receiving is going to be just pure marketing. Medicare is not going to call and ask you to update your information. They're not going to send out letters requesting information. They already have your information.
Right.
We have open enrollment coming up. What'll happen around this time of the year? So we're talking in September now.
So before we get into that, who's eligible for Medicare?
Oh, sure.
Because we get people confused all the time on, I'm on Medicaid. It's like, you're not on Medicaid.
A lot of people.
Medicaid's for poor people.
Right. Yeah. Medicaid. So low income individuals for Medicaid. Medicare is different. So Medicare is a, federal program, as opposed to Medicaid's more state program, but Medicare, typically for individuals 65, would be initially eligible to enroll in Medicare, as long as they have 40 credits, which most people would. A credit meaning that they've paid into, the system through an employment for 1 quarter. Yeah, so 10 years worth of employment. So you can get either through your own record, or you can get through a spouse if you've been married for at least a year, and that spouse is 62 or older. Some individuals will get it through a spouse, kind of like Social Security. So you'd be entitled. Those individuals under Part A at no cost. So Part A is the hospital side, and then Part B is for the doctors, right? So there is a cost or a premium for Part B. Right. Some people don't pay it if they're lower income. So if they have Medicare and Medicaid, they're typically not paying it. But for most individuals, most Americans, they're paying that Part B premium, and that changes each year. Yeah. So that's one thing that we have coming up. is the new Part B premium amount and the new Part B deductible. Hasn't officially been announced yet. They're speculating it's going to go up about $10 or $15.
So it's like $165 now, so
right?
About $175 a month.
Exactly.
And but if you make more money in retirement, including your IRA withdrawals,
yes,
you have IRMA, so that will continue to increase your payout. So
yeah, and
there's
I'm sure
pretty big gap though between 165 and the next level.
There is, yeah. So for most individuals this year, if it's I think 197,000, they go back 2 years, so they're still looking. In 24, they're going to be looking at your 22 tax return, your modified adjusted gross income, which I'm sure you can help them determine what that was, and determine what the premiums are going to be for that given year. So it's around 200,000 for an individual. For a husband and spouse, married couple. If they're 197 or higher this year, they haven't announced it next year, but it'll be around 200,000. Yeah, and it goes up from there. So that's when you're looking at your financial planning. Does it make sense to do a Roth conversion? Does it, make sense on how much you're going to be deducting from your IRA? Because that can have a direct impact, and you might be shooting yourself in the foot because you're having to pay on this other side for higher Medicare premiums.
Yeah, that makes sense.
Yep.
All right. So then they have what we're going to talk about today. The renewal of is the Part C Medicare Advantage plans, right?
Yeah. So Medicare it's really going to be
that's in addition to Part A and B.
It is. Yeah. So there's a few ways you can receive your Medicare benefits. You can either receive them through Part A and Part B, which covers in general about 80%. As an oversimplification, you can fill that in with a Medicare supplement plan and a prescription drug plan. So that's one direction someone would go. They would have A, B, Medicare supplement to help cover all or most of that missing 20%, plus a prescription drug plan. So the things that original Medicare A and B do not cover for would be for retail prescription drugs, which is also Part D. You get that through a private insurance company. They don't cover for dental. They don't cover for vision for the most part. So that would all be separate coverages. So I kind of describe it as insurance a la carte if you're going the Medicare supplement route. The other way to receive Medicare is through a private insurance company, which would be Part C, otherwise known as Medicare Advantage. So that would be through a private insurance company. They now take over the management of your Medicare benefits. You still have Medicare. You just kind of think of it as the advantaged version of Medicare. So that's going to look very different across different plans, across different companies, across different, not only states, but even counties. You'll see a big difference. So when you see these now, kind of going back to our initial conversation, when you see these national television commercials saying you can get all these benefits, well, yeah, that might be for 2 counties in Florida, but not necessarily in the county where you live. Yeah. And there really can be a big difference.
That could be overwhelming. There's so many choices.
There is, yes. It gets very overwhelming, and it's very difficult for, the average person to do the shopping on which, if they're looking at Medicare Advantage, which plan is going to be best. Because unlike Medicare Supplement that is on a very standardized plan design, Medicare Advantage are going to be very different from one plan to the next, especially when you start talking about some of those bells and whistles like the dental and the vision and prescription drug coverage and gym memberships and grocery allowance and a lot of these newer benefits that have really just been added in the past 5 or 10 years on many of these plans. So they've become more popular. You actually have more individuals that are signing up for Medicare Advantage that are when they're turning 65 than they are for Medicare supplements. So they're becoming a bigger part of really the overall system. And we've seen some changes too. So, as far as new legislation that we've had, the Inflation Reduction Act that was signed last year, a lot of the provisions of that have to do with Medicare. So, this has been talked about in the news quite a bit. You have the reduction of, they're trying to reduce the cost of prescription drugs. That's really the biggest one out there. Of all healthcare categories out there, for people that are Medicare, prescription drugs is the highest out-of-pocket expense. So, it makes sense for them to start in that area. We've had some of the provisions go into effect this year for Medicare. So most people know of the insulin savings program. So that's under Part D, which you would either have under a standalone prescription drug plan, or you would have under Medicare Advantage. On most Medicare Advantage, not all Medicare Advantage include prescription drug coverage, but for those plans, $35 would be the limit on the monthly amount for insulin, as long as that insulin is listed on the formulary. So it's not necessarily every single insulin is on there. I think there is some confusion on that. So it is important when somebody's looking at a drug plan, whether it be, again, a standalone or a Medicare Advantage, is look up your medications, figure out, make sure you understand what the expected cost is going to be on that plan for the next year. And that's what people are doing, really come October 1st. So October 1st to December 7th, you'd be able to shop those new plans. You'd be able to look up those prescriptions, see what tier they fall into, see what your estimated cost is going to be. So I think we're going to see a lot of changes in the Part D prescription drug plans, especially because of the Inflation Reduction Act.
When you're working with a client, is that one of the first things you do is ask for, hey, what prescriptions are you on?
Exactly. Yeah. So I'll run a detailed report. We'll look up the tiers. We'll cross-reference that against different plans. Because the nice thing with prescription drug plans is you can change them every year. So they're not going back and looking at pre-existing conditions or, current health conditions as far as eligibility goes.
Right.
As long as you sign up during that period of time, then you can change plans. Now, if you miss that window, it's tough. You might be out of luck and you might be on that plan for the rest of the year. So it is an important time period during that 6-8 week period to reevaluate.
Do you find that almost all doctors take these different plans, or are there doctors that don't want to mess with Medicare and you can't use them?
Yeah. I mean, again, some of that's going back to the scare tactics where, people say that, there's more and more doctors that are not taking Medicare, which, there are some that are choosing not to accept Medicare patients, but the vast majority of them are going to be accepting Medicare patients.
And do they not want to take patients because of the payout time?
Right. The reimbursement rates on it. So are going to be lower than, say, like a corporate plan. A lot of providers are going to want to take those corporate plans, especially they're going to be richer in benefits and, maybe pay out a little bit quicker on it. And that depends, Medicare supplement versus Medicare Advantage, there's going to be some different benefits to the provider there. Again, those are kind of skinned a little bit differently, but original Medicare is more of a streamlined process. So you'll find a lot of providers that, might perhaps prefer those plans. They're able to submit those claims, get paid a little bit quicker. Medicare Advantage, you're going to have networks. So just like any PPO or HMO plan, you want to stay in network to get that preferred pricing on it. So it is much more important for somebody, if they are considering a Medicare Advantage plan, look up your doctors, which of course that's something I do with my clients, make sure that they're going to be in network with the plan. Some plans, again, you can go out of network, but usually you will pay more to do so.
So during this renewal period, is this something that you should shop out every single year, or is it something that you just pick one and now you're good?
It used to be that way where you could pick one and you're good. But to your point, since we have so many new plans, you really should be shopping it every year. Prescription, I would say, is number one to look at, because that can really make a difference in, somebody's budget depending on what plan they're on. And then, if they're on Medicare Advantage, or if they're considering a Medicare Advantage plan, they need to look up the networks, look up the benefits. We just have far more plan options that were available even 5 or 10 years ago. So they should be looking at Medicare supplement. That's still perhaps a little more of in the category of set it and forget it type deal, since those are not going to change very much from year to year. You're going to have a premium increase, but you can change those plans. You can change those plans at any time. However, you do have to go through health questions. So unlike prescription drug plans or Medicare Advantage, where you're going to have a certain window to enroll, Medicare supplement, if somebody's currently on a supplement, then they're going to have to, reapply and go through those health questions to determine eligibility. And it's worth doing. Usually you can drop your rate a little bit, if you're in good health. For some individuals, they just may not have the opportunity, that the new insurance company, depending on their health conditions, may not accept them, or there might be a higher rate. But it's always something to take a look at. Yeah.
So that process, you just mentioned rate, a rate increase, we were able to really keep our, let's shift to small business owners for a minute. We were able to kind of keep our healthcare costs about the same this year through your help. But that's not normal. I mean, there's been pretty steep increases every single year. In fact, I believe for most small business owners, about 15% increase is pretty normal.
15 is pretty normal.
But it's also because people are aging. That's part of it too.
That's it.
Every year you're a year older.
Yeah. People forget. It's like, oh, why'd my rates go up? Well, everybody in your company is now a year older.
Yeah. So that has something to do with it too.
That has something to do with it. Yeah.
In Georgia, we're losing Humana at the end of the year,
right?
As a corporate insurance option, which leaves us with 3 different carriers basically.
Yeah. It depends on the size of the company on what options we have, but
under 100.
Under 100, you're looking at, the main ones are going to be Blue Cross Blue Shield, which is Anthem, and you still have Aetna, United Healthcare, Cigna, Oscar, some of the smaller ones out there, and then we have a few others, like Allstate has a division now that they took over from another carrier. But usually when you're talking about the networks, there's just a few. You got the big boys out there, which is going to be the Aetna, the UHC, and the Anthem. Mm-hmm.
So, we're entering campaign season for president.
Yeah.
And so it seems like every 4-year cycle, universal health care comes to the top of the debate. Right. And, I think I know maybe a little bit of your stance on that. You shouldn't explain it to our listeners, but, as a planner or as a voter, I would go in and say, no, we don't need that. We don't need to be paying for that. But then as a planner, when we're doing financial plans, especially for young people, we have to use the historical inflation rate for healthcare, which is 5.3% per year. So that's built into all of our plans that their healthcare costs from today until they're 95 to 100 years old will increase at 5.3. Now, put that in perspective, the Fed target rate for the cost of living is 2%.
Right.
So we use 2.5% in our planning software to give a little bit of a buffer there, right? Year over year, I think we're around 3.75. Inflation's come way down year over year.
Right.
So I guess, my question is, or I guess I'll finish my comment first, is with a young person going out 20, 30, 40 years, healthcare is like $60,000 to $80,000 a year, depending on how young you are today. That's insane. In fact, in some cases where you have a younger family, not high income earning, ends up being 50-50. 50% of their costs in their retirement is healthcare. The other 50% is living.
Right.
Does it actually happen? Well, would it actually happen like that? That I don't know, but I do know that we have to use historical data to try to predict the future.
Yeah, and I think that the data that you guys are using is pretty conservative, which is, in my opinion, the best way to go from a financial planning standpoint. Sure. But we're going to see a lot of changes. I mean, we've seen a ton of changes. I mean, the Affordable Care Act that was, signed 10 years ago. So here we are now. We have a lot of changes in healthcare, but it's really, from the point I'm seeing it, it's going to be much more tied to your income, because we're seeing it all different levels now, right? So Affordable Care Act for individuals, whether they be self-employed or they're not offered health insurance through their company, then that premium is going to be directly tied to what their current income status is.
Well, that's a good point, because we have a lot of retirees between 55 and 65 that don't have health care. And usually the trick is you live off your brokerage account. I mean, which is kind of silly, but you live off your brokerage account. You could have $10 million in investments, but your income is low enough that you qualify for ACA, which is pretty much that sweet spot, 70,000 or less.
There's a bunch of factors that go into it.
Married couple.
For a married couple that's in their 50s or 60s, they would still qualify at $60,000, $70,000 or less for sure. Even higher than that.
Like a pretty big deduction at 70,000.
Oh yeah, massive deduction. Yeah, I mean, you're talking, it could be 50%.
Yeah.
But there's a bunch of factors that go into that, and those allowances will increase likely each year, at least with inflation. So. I think that'll become a bigger part of the financial plan is, looking, how can I draw more, tax-free income? So if that's looking more at Roths, maybe for individuals that have been more, contributing to traditional or, regular 401ks, that's going to make a big difference, not only in your tax liability, but also in the premiums that you pay, whether it be ACA, if that's still around in 50 years, probably not, or your Medicare premiums, which again will still continue to be.
So I just don't see how we don't end up on some path to universal health care based on cost. Where they are today.
I mean, it might be. So when you talk about universal health care, so more like
Medicare,
public systems.
Medicare for all, basically.
Yeah, which is a little bit different than I would describe from like universal health care. But yes, like more of like a one-payer systems.
Yeah.
I absolutely see us going that direction. There's a lot of writing on the wall that we're moving in that direction. A lot of funding, both on the ACA side. Mm-hmm. And the Medicare side. So, I mean, the systems are already in place there, for us to have a one-payer type system, and we're not putting millions of Americans out of jobs like me and the insurance companies.
Right.
You're really just going to have insurance carriers that are going to be managing it, right? And they're just going to be compensated by Medicare, which is what you have on Medicare Advantage and what you have now on ACA. So, the systems are in place there. This is a testing phase. This is a data collection phase. And then maybe the AI is going to tell us which way
to go after that.
Yeah, absolutely. The question mark, and that seems pretty clear on both the individual basis and Medicare basis. The question mark really becomes on businesses. How are businesses going to be affected here? Because
the small business owners could get squeezed.
They have been squeezed. The small business owners are the ones that have been squeezed the most with the Affordable Care Act, with just all the changes in, inflation, far outpacing, healthcare inflation, far outpacing inflation. So, the small businesses are going to be the ones that are going to be hit the hardest. So I'd really like to see more, assistance there. But they're trying to skin it in a bunch of different ways, for some small businesses.
I've always wondered, with small businesses, so insurance is ranked by your age, right? And then kind of like a group. So if there were coal miners, you might pay higher premiums than people who were working at a sewing factory.
For sure.
So I guess my point is that as financial planners, you could take all the financial planners across the country and create a group and say, we're going to insure this class of people, and that's your massive group. It would be all the small business owners as part of a, why is that never happened?
So
is it political because it goes across state lines? Is that the problem?
No. So I guess the closest thing that we have to that would be like association plans. Okay. So we'll have association plans where there'll be,
but those plans are weak.
A group of dentists. Well, some of them are, some of them aren't. But the problem is the people that buy into those plans are going to be the ones with the health conditions.
That's true.
So it doesn't matter the industry, right? Yeah. So even if you have, for example, you have the, several dental associations here in Georgia,
right,
that allow individuals to buy into it, but it's the people that with the higher health conditions that are paying into it because they're willing to pay up for it versus going to the Affordable Care Act. So that in turn increases the rate. So it's not an easy problem to solve. For sure.
Interesting. Yeah. All right. Well, maybe that's the difference. But every year at renewal, I'm always like, why don't we just form a bigger group to get the discount? Yeah. I just need to form my association of healthy people. we'll call it that, the Small Business Healthy People Association.
Well, we used to have so right when the Affordable Care Act started, we had the high risk pool, which I thought made perfect sense. Individuals that, were at a much higher risk rather than bringing up the rates of all the other individuals that were maybe at normal risk or low risk under the plan, put them in a separate category and have higher federal funding. Made perfect sense, but it went away. I was only around for 2 or 3 years.
Yeah.
Yeah. It just wasn't utilized. So maybe we'll come back to something like that.
So what is the breaking point on the system, do you feel like? Is it just the cost and no one can bear the cost, so the taxpayer has to step in and fill that? Or is it people being angry because of, I don't know if we have lack of healthcare. I mean, the people are still getting coverage.
Sure.
Just maybe not at the cost that they want.
Yeah, I think a lot of it is going to have to do with the economy. We saw kind of a taste of it with COVID, right? So you had all these furloughs and layoffs and, people having access to care and, not being able to schedule surgeries. And, it was kind of an eye opener at that point. I think the breaking point is probably going to be just costs. I think it's going to start with the business owners. I think they're the ones taking the big brunt of it right now. But again, there's just not an easy solution. But we're moving closer and closer to a one payer system. It's just a matter of kind of bringing taking my political beliefs out of it. It's just a matter of just kind of bringing everybody together to understand that that's inevitable, in my opinion. I think that's where we're going to go.
What do you think that does to the medical profession? Because I feel like that. Yeah. What happens with them? Do they become unionized or something?
Oh God.
Because you think about if it's a one payer system,
right?
Everyone's fighting for those resources.
Right.
And how does the good doctor get compensated more than the average doctor or the doctor that barely got out of school?
Yeah, it's tricky. So they're trying to, I guess where we see that right now is like on Medicare Advantage plans where they're creating more incentives for providers, for doctors, for hospital systems to keep the patient healthy. So there's different metrics that they use for that in order to incentivize that provider. So it'll probably be some sort of combination of that, very complex strategies that, measure that effectiveness of the plan that can be used into plans, whether it be, a full kind of Medicare for all, which again, I think we're going to go to, but the biggest question, I'm pretty confident of that. I don't know if it's going to be in 10 years or it's going to be in 50 years, but I think that's the next step. Maybe universal health care, but I think we're far off from, having a universal health care plan like that. But again,
it'll just be sneaky. It'll just be one little thing at a time to the next thing.
That's the way it's been.
We're pretty much there.
Well, you remember, back when they tried to sell, it was an oversell.
Yes.
Yeah. So it was like, we're going to have universal health care. So we're going from like 5 miles an hour to 150 miles an hour.
Right.
And then we landed on the Affordable Care Act, which was somewhat, I guess, the compromise of it. But it's just a foot in the door to, where we'll inevitably be going. But again, I think right now we're just in a data collection phase just to figure out what's going to be most effective.
It's also putting a face to it. I mean, so many people are so passionate about not funding universal health care and why we shouldn't do it. But when you have a client who has cancer or has had cancer, and for whatever reason, they can't work anymore and they don't have any health care, and you're like, why isn't there a solution for this?
Right.
And you have a real face and a real family, you feel very different about it than when it's just a concept that's in a political ad.
100%. Yeah, I think, I don't know, my personal opinion, talking to individuals, their big reason for being hesitant about a universal healthcare system is you're going to have basically the government controlling and dictating,
what can be covered and what
can be covered. How your healthcare system is going to look, rather than coming from your provider that's going to be working with you directly. And I think that's less of a concern now, because you still have independent providers, they're doing their own, service. They're not being dictated, they're not going to be employed by the federal government. I don't see that in our lifetime, even for the 20, 30-year-olds that are planning out right now. I'd still be surprised if we have a system like that where you're going to have medical providers that are employed by the federal government.
I think the conclusion that I've come to, and from my perspective, I was on a hospital nonprofit here in town, and it was supposed to be a VIP, and I don't need a whole lot of healthcare, thank goodness, but my mother did, and she went in for a surgery, which should have been somewhat routine, although it was a very abrupt, hey, we got to do this now, kind of a surgery, and it was a disaster. She basically went through, surgery with no painkiller whatsoever. It was like Civil War era.
Yeah.
It was so bad.
Yeah.
I resigned after that. I was like, and I just started thinking about the entire healthcare process and how do people get the best care? And what I came down to is preventative. Like, you got to hit the gym, you got to eat right, you got to do the things that you need to do to keep yourself out of that situation. Because even in the current state of healthcare, not even talking about universal state of, because what people are fearful of is, oh, you're 95, it's not worth fixing you anymore. We're going to let
right.
you go. And that's
Right.
not what we want as a society at all.
Right.
What we want is the best doctors doing the best work and treating everyone equally. And what I experienced was, okay, I'm supposed to be, in this case, preferred patient, right?
Mm-hmm.
And my whole reaction to the whole situation was, what if I was a Mexican in town? I barely spoke English and I needed to have this surgery, which is plausible for anyone of any age to have this surgery that was done on her. Where is their voice? And I'm still angry about it. And so again, I think the best medicine is to take care of ourselves and make sure you're going in for your checkups and do all the preventative things.
Yeah. You're eating right. You're exercising. You know,
that's what you,
some
that's
of
what you got to do.
Are not used
but
to.
I'm fearful of the system. I would pay a premium. I would pay a premium to make sure. It's like they all take the oath to take care of everyone, right? But it's just like when you fly. There's the front of the plane, there's the middle of the plane, there's the back of the plane, and I feel like that healthcare is a lot like that. It is, but it's not. There's no sign that says it, but just in how you're treated. I tell people that work with me, I said, if you go to the doctor, dress up. And they're like, what? You go to the doctor, you're sick. You walk in your gym shorts and a t-shirt. And I said, no. You dress like you're going to work. And what you'll find is that you won't have to wait as long. They'll see you faster and they'll treat you differently.
I like that.
And that's
a good tip.
The person came back and was like, you're right. I didn't wait at all. I went straight in.
That's a good tip.
I was like, walk in there like you own the place and you get a little different treatment. And so but it shouldn't be that way. And I don't know how you fix it. Maybe it's human nature. I don't know. But the whole hospital process it scares me. I'll go visit people if they'll let me in the door. But every time I'm in there, like, oh, I don't know about this whole system.
Yeah, I hear you. Yeah,
and universal healthcare is not going to fix that. ACA is not going to fix that. But there's definitely a problem, and a hospital CEO needs to figure it out. And once they solve it, that'll be the template for the rest of the country. But so far, no one's able to do it. That's my 2 cents.
I agree.
The state of healthcare.
I agree. Yeah, no, it's a massive challenge. It's a massive challenge. But I think we're improving.
I don't know.
Silver lining.
Yeah, maybe. I obviously with social media, I think social media improves service in a lot of areas. Because you can only, I did not go to social media about any of my issues. I have a podcast, but I was a little perturbed by the whole thing. And when you talk to clients, when they come in, we have thousands of clients that pass through here every year, and they all have their stories. And I'd say a lot of them are positive about experiences about local healthcare, but a lot of them are not so much.
Right. Yeah, you'll find that kind of going back to Medicare. I mean, a lot of my clients, I tell them, like, you're going to be relieved. You've been paying to the system all these years. You finally get to take advantage of it. Yeah. So most people see that, hey, wow, this Medicare works great, regardless of where they go.
I'll clarify that this has nothing to do with Medicare, this story. This is the service provider.
Right.
As far as financials go in Medicare, it's actually a great system. I was trying to convince someone recently. They said, oh, I'm doing Medicare. That's terrible. I'm like, what's terrible about it? If you fall and have a hip replacement on Medicare, I think it's like $7,000, something like that, or maybe less. Where corporate insurance, you'd hit your max out of pocket in a
and if somebody has the right insurance on playing like a hip replacement, they're paying virtually nothing.
Nothing. Okay.
Likely less than $1,000.
Okay. Well, you just proved my point. So cost wise, it's a great.
It's great, and it's just having that access to care. So us being more metropolitan area, it's going to look very different than maybe rural Oklahoma.
Right.
Right.
True.
So that's going to make a major difference in the care, the access that you have. For some of those individuals, I'm likely going to recommend a different plan for them versus what I would recommend here. But having that overall main access to care is the biggest issue. And that's kind of going back to what you're talking about. So you're having more people that are traveling for it. They're going out to MD Anderson, they're going to the Mayo Clinic. And if they're not on the right plan, they're not going to have access to some of those places. So, Yeah.
Well, that's what I learned today. I would have thought you have just, worked really hard when you turned 65, picked the right policy or plan, you just stuck with it. And so what I learned today is that probably should be evaluated each year. So thanks for
sure
bringing that to our attention. And Logan, if they want to our listeners want to get in touch with you, how do they find you?
Sure. So they can go to my website, steelechoice.com, STEELE. choice.com. Welcome to give me a call. There's a spot on my website where they can schedule a call, 30-minute consultation, and go through any questions they have. Welcome to email me anytime. So I'm local here, offer all the same plans that Joe Namath offers, but able to help out individuals more on a local basis.
Joe probably doesn't answer the phone, so you answer the phone.
I doubt it. Yeah. I answer the phone.
All right, Logan.
Thanks, Casey.
Thank you for coming on. We'll put your link to your website in the show notes below, and a couple of other podcasts if you want to learn more. Episode 155, Key Things to Know About Medicare Enrollment. Episode 111, Differences Between Medicare A, B, Medigap, and Advantage. That's a great episode if you want to learn more about the details of this, and we touched a little bit on it at the beginning of the podcast. Thanks for listening to today's episode. If you're interested in learning more about Wiser Wealth Management, I want to schedule a consultation to meet with one of our fiduciary financial advisors. You can do so by going to wiserinvestor.com, or you can click on the link in the episode notes. Thanks, guys. See you next week.
Thanks for listening to a Wiser Retirement podcast. We hope you enjoyed today's episode. Make sure to subscribe wherever you're listening. That way you don't miss any new episodes. We'd also appreciate if you could leave a rating and review. If you have any questions about anything that was discussed today, head to wiserinvestor.com and reach out. This episode was produced and edited by Ken Hoadley.